clap. I didn't know that's right. I'll clap, and that's like an audio cue too.
All right, guys. Welcome. You know me. I am Shannon, also Miss Detox. We have been on our detox journey together for about a decade now. I'm going to introduce you to my biomagnetism therapist and good friend, Danielle Pillarino.
Hello.
We are going to talk about brain trauma and biomagnetism therapy today. I told you guys in a video a few days ago that I was going to come through with some information on how to really alleviate symptoms from brain trauma. And so Danielle's just going to give us a little rundown real quick of how biomagnetism therapy works, what it is, and then I'm going to give you a little information on the symptoms that I've been experiencing, and Danielle's going to tell us how she helped alleviate them.
Sounds good. So biomagnetism, it's also known as biomagnetic pair therapy because you use pairs of magnets, a black and a red one, is not really common here in the U.S., which is a shame because it's a very powerful therapy. So I'm just so happy Shannon's here spreading the word. Now, how it works is it's a combination of biofeedback and energy work. When I work with my clients, we're really tapping into the subconscious, and their body is guiding me. I always joke, I'm like, I don't know what's going on. I don't know what's wrong with you. I just ask the questions. You know how to heal yourself. Your body knows what you need. I'm just there facilitating. And how the magnets work is we're primarily balancing pH imbalances. Those pH imbalances, either an area that's too acidic or too alkaline, because the body likes to be neutral. It likes to be like 7.3-ish. So it likes to be very neutral. So if it's too far either way, that creates imbalances. Why does that matter? It matters for several reasons, but one of them is when the pH is off, things can grow. So things being in people, bacteria, viruses, parasites, funguses. Think of a swimming pool. In the springtime, when you open up your pool, it's all green and mucky and stuff growing in it because it's not at the right pH. So when you clean it up, then it's beautiful and crystal clear and you want to swim in it. Our bodies are the same way. So we need to balance out the pH so that our bodies can just run more efficiently and it's not being like bogged down with all this junk inside of us. Now, this is why the magnets work. This is going to get like really nerdy. Go back to high school chemistry. pH imbalances come about because we have an excess of hydrogen, which is H positive, or hydroxy, OH negative ions. Those charges, the positive and the negative, create electromagnetic fields. So that's why the magnets can work on them and neutralize them. And we find these two areas that are energetically resonating with each other, one that's alkaline, one that's acidic. We push the excess molecules towards each other. They create H2O. And so we have like excess water. That's what the kind of the byproduct of it is water. And those areas are now at neutral. So whatever was there can't survive there anymore. If something needed to have an acidic environment to thrive, like a fungus, you bring that to neutral, it can't be there anymore. And then your body just helps expel it through natural like waste removal. That is biomagnetism in a nutshell. And Shannon's going to talk about how we used it with her, in this case, to deal with a traumatic brain injury.
Yes. So you guys know you love what Danielle's saying here because all I've talked to you about for the last 10 years is pH imbalances and how to heal the body through that. So for me, most of you know that I was in a traumatic car accident in 2012. I was hit in the temple and then severely concussed for better part of a year or two. Vertigo, dizziness, walking issues, writing issues, speech issues, cognitive issues, fatigue, body pain. One of the most common things is I describe the body pain as being like fibromyalgia, fatigue, and body pain, weaknesses, and then even things like the weather changing, causing more pain and discomfort in the body. Danielle and I started working together a few years ago with the children, and we had not really focused on the brain trauma until about, I say like 3 years ago, probably. And when she started working on specifically on my brain trauma, my life changed. I became more cognitive. I became more physically strong. I became able to process my thoughts and acquire memories from, my past that had seemed to have been lost. Just that whole sense of when you have a brain trauma, you want to just kind of get back to or find some sense of how do I maintain in this world, Danielle was able to help give that back to me.
Yeah, it was really cool to see that change. And then just recently, last Tuesday I saw her. She had another traumatic brain injury, which re-triggered a lot of those symptoms that she was having. So as soon as I heard about it, I said, come on real quick, let's work on this before it ends up really going down a slippery slope. So when you come in for biomagnetism to deal with traumatic brain injuries, a couple things I like to do. I like to really focus on blood flow to the brain, because the more blood flow and oxygen you have anywhere, the faster it's going to heal. So we work on the carotid arteries up here in the temple, another vascular system in the brain called the circle of Willis. We use all of those to bring great blood flow to the brain. Then we use the body, her subconscious, and I find out I have a little map that I use to help guide me, and it's an electroencephalogram map, EEG. So it's when they put all those little electrodes on your brain, so it's covering most of the head, and I use that as my guide. Okay, where does Shannon have a traumatic brain injury? What does it need to be addressed? And sometimes in her case, it was a very, very blunt traumatic brain injury, caused a concussion. Other times it's not as severe. So I do use that term, traumatic brain injury or TBI, loosely, because it could just be like you banged your head getting in the car one day. And it was enough, not necessarily to create brain damage, but to create an energetic imbalance there. So we work on balancing that out. Often it's just bringing down inflammation and bringing blood flow there. The reason the magnets help with that, because that area becomes more alkaline when we use the magnets. And in physiology, it's called Bohr's law, that an area that's more alkaline, when red blood cells, they have in them hemoglobin, that is what makes them red. And that's also what allows the red blood cells to bring oxygen to an area. So in an alkaline environment, hemoglobin can carry more oxygen. So you're getting better the blood flow in general, but better oxygen to that area as well, helping it heal. The other thing it addresses is it's a weakness that you have. So think about your janky knee that you got from a skiing accident, right? And it's never been the same. And now when you get a thunderstorm comes, your knee aches, right? That's just a weakness in the body. The same thing happens in the brain. So those weaknesses, other things that settle in sometimes are emotions. Very specific traumatic emotions and conflicts can settle in there. Or I see a lot of my clients that have fibromyalgia and Lyme disease, chronic Lyme, also have these imbalances in the brain, and that's where the Lyme has settled in, because medications don't go through the blood-brain barrier. It can't get to the infection that's affecting the brain. So with the magnets, we're able to balance that area out, and then whatever's there, once it's balanced and neutral, it just goes away. It helps release those emotions. You process it easier because a part of you is not trapped, vibrating at that frequency, and you can just move through it, and it just heals, because that's what your body wants to do. Your body wants to heal and knows how to do that. We're just facilitating it, and that's why I love biomagnetism, because it's specific to what does each person need. It's specific to what does Shannon need, what part of her brain. Did it need more blood flow? Did it need to bring down inflammation? Did she have an emotion there? And that's what the whole session is about.
And as a client, all I have to do is show up and lay down. It's a very easy treatment. It's non-invasive. Danielle really just does all the work, and that's kind of a nice part about it. There's no.
Yeah, it's super. Most people fall asleep. So
take a little nap. Take a little nap.
I doze off. I'm like, oh, that's fine.
But the new wave of healing, the new wave of how we're going to get ourselves healed in this society is going to be energetic healing. And Danielle's on the brink of that with biomagnetism therapy and working with people like me and my children and a lot of other people who are suffering with everything all the time. So if you have any questions about the biomag itself or about brain trauma and how Danielle could be of assistance to you for that, or anything else that maybe you heard her mention, just reach out to me, myself, or her. Her information will be in the video link.
All right. Thanks, guys. Bye.